So this project came about because of the worldwide supply chain shortage that happened during COVID. What happened is a lot of the countries that make the supplies that we use here in the United States actually shut their borders, and suddenly we didn't have access to those supplies. One of those supplies was the test kit, the test swab that is used as part of the COVID test kit, or any test kit for that matter. And so we had to address that as a group, figure out a way to create a new supply chain in a way that we've never done before.
We were able to print 300 plus in one batch. This is how they will come out of the printer.
I'm here in radiology, and radiology was able to come up with some of the early designs on this, and then we worked immediately with our colleagues in infectious disease, their bench lab scientists and their virologists, but also working with our colleagues in emergency medicine, the nurses that were on the front line, the people out at the test sites. These are the people that are going to be on the front lines using them. And also we needed isopropyl alcohol to be able to make these, and the chemistry department came forward with isopropyl alcohol for us. And so one of the things that was really critical to this, beyond when just printing them, was actually making them ready to go out as part of the test kit, and that was all student work. A clinical trial that we set up here at USF, the results that we found between our hospital, Northwell Health, and Thomas Jefferson University was that the swabs clinically were actually performing as well, if not better, than the traditional swab. And so this was really exciting for the whole team. Nationally, we were able to partner with a company called Forum Labs, who actually makes the printer that we use, and we were able to give them our patent pending rights to be able to print these. So what this swab represents to me is what can happen, the wonderful things that can happen when everybody works together, puts all those boundaries aside that we normally have between us, and this is my field and this is your field, but works together as a group towards a common cause and a common purpose.
Starting in the summer, we started to adapt pool screening methodologies to test a whole variety of different samples that were coming from the USF community. And we've been doing a lot of the testing for USF for the athletic department, and also for the random testing that's been ongoing on campus. We were contacted and talked to the people at the FDA over the summer to try and institute this program. So I think we were one of the first to actually use this approach. Well, we're testing the athletes twice a week, I believe. The last number that I saw was around 3,400 athletic samples that have been run. We've run about 800 or 900 random samples, and probably an equivalent number of environmental samples so far. I have a lot of students who are involved in collecting the samples that are out there, so somewhere around 5,000 or 6,000 samples, I would guess, total. So it involves basic science, molecular biology, epidemiology, mathematical modeling. Also, I do a lot of things to try and encourage the use of wearing masks on the media and everything, so community outreach as well. It's really important right now for USF to really try and identify hotspots on the campus, to try and jump in there and try and control the spread of this epidemic on campus. I think it's, along with encouraging the use of masks and social distancing, it's a really important reason why USF, unlike several of the other universities in the country, has not seen a tremendous outbreak of COVID-19 infections among the student population since the beginning of the semester. A lot of the credit can be actually given to the students themselves, the undergraduates. They're wearing the masks, they're doing the social distancing, they're not holding large parties. And as a result, we're seeing many fewer cases than a lot of our peer institutions out there. So I think the university is doing a pretty good job of controlling this epidemic on campus, and I think we're a pretty important part of that.
As a part of the hospital-based rehab team, we have a small group of volunteers, PT, PT assistant, OT, OT assistant, and speech, who volunteer to provide care to the COVID patients. So it is a group effort. I am part of that group. And what we've been doing is doing their evaluations to determine their functional mobility, and as well their positioning and discharge recommendations. And we also expanded into becoming the positioning go-tos for proning, which is a big new thing in COVID. Proning requires you to take all of the monitoring off of the patient when they would be laying on their back and then move them onto their stomach. It's a coordinated effort with the nursing, the physicians, especially for the medications to have them paralyzed, and then the respiratory therapists who were phenomenal in helping us with the respiratory status with the ventilator, as well as being in control of that when we put somebody into prone. But as a physical therapist, I need to watch how the mobility of all their joints are. So to make sure if they have limitations in their neck that we're not putting more harm on their neck or their shoulders, as well as their pressure points. So they're going to be on their stomach for 16 to 24 hours. We don't want them to get any skin breakdown. So also putting prophylactic bandages on and working with pillows and wedges to keep them safe while they're in that position. Research shows that therapy will help reduce your length of stay, reduce delirium, prevent you from getting ICU-acquired weakness. So what we're doing is trying to keep people at the highest functional level possible so that when they have recovered, they will be able to return to their prior life.
I'm the operations director for the COCO Clinic. It is the COVID-confirmed clinic. The medical director is Dr. Elimaris Perez-Colon. She's one of the USF MedPeds physicians. And we have from the USF Quality and Patient Safety Department, nurse manager Christine Jennings. And we have our data manager, Dr. Rochelle Idziak. We knew that patients with COVID were going to be, excluded from being in the building, at any building, regardless, right, for care. They could go to the hospital, but then they were going to be isolated. But for follow-up after the hospital, we don't want them coming in the building with other patients. So we knew we would have to set up a separate way to take care of them. That would be virtual. That would keep other patients safe and staff safe. We literally could not do it if we did not have an interprofessional team. We're leveraging the things that they're best at. They get a list of patients. They may be newly diagnosed yesterday, like the day before with COVID, or they may be people that we've already followed a little bit. They run through medical assessment, social assessment, and mental health assessment with the patients. We ask them 5 questions that screen for depression, anxiety, and substance abuse. And if they answer yes, then we offer them to talk to specialists in mental health. And if they agree, then we make the referral to the mental health team of COCO. So they were calling this one patient the next day, and they found out that the person was really in crisis and mitigated a real suicide attempt. And we have kind of like an Apple Watch with an extra sticker on your finger that connects to the watch. And it monitors your oxygen level and your heart rate 24/7. The battery lasts 8 days. We can ship another battery to the patient if we need to. So we put that on the highest risk patients. Tampa General is hiring some additional nurses to be able to help with doing that monitoring aspect together with our students, so that if we get another surge, we'll have more staffing. We'll be able to take care of more patients. If we never get another surge, we can also transition this to take care of other types of patients like heart failure or COPD patients using the same monitoring and staffing model that we've had. We have seen over 4,700 patients so far. I would say the thing that's also pretty important with interprofessionalism is actually having all of the different disciplines have multiple communication touch points that are throughout the day so that they're actually integrated. Because I think what happens often is it's just parallel, oh, okay, mental health is here, primary care is here, and we can refer this way and they can refer that way, but they're not talking to each other, right?
I think it's really important because you can bring in a whole variety of different disciplines and a whole variety of different perspectives on a problem.
I really think it's the best time I've seen all of my peers working together for the outcome for the patient. And it's a scary environment, but everyone has just jumped in and been prepared to work together to make it happen.
We are a team in healthcare. That's why it's important for all of us to work together, and we can't do it all by ourselves. And what this really illustrated is that sometimes you have to step outside of your normal day job, your normal role and figure out ways to help using the technology, the innovation that we have, that we use every single day to help our patients, but in a different way. And then working with those colleagues that maybe I didn't come across before. It wouldn't normally be in their world, but working together to fight this is the only way you can defeat a virus like this.